And then for treatment planning, this is a huge one, just like my filling up my tank lecture. Treatment planning. Treatment planning is dependent on your patient and the condition that you're treating. I like to break it down into repair, stabilize, maintain. When you get into maintain, that's kind of your preventative health, just to keep things in order, even if you might not feel like you need to keep things in order. You do, because we're high maintenance vehicles. But the repairing, just like when we do Chinese herb prescribing, medications, massage, everything. You need to do a little bit more in the beginning because we're building, it's building blocks. Each treatment's building on the other. So in the beginning for repairing, I'm usually telling my patients at least 2 to 3 times a week. Now, if they're really low on the pain scale or, they don't have that much time, then I say come in once a week. Something is better than nothing. I don't want them to just say, oh, I can't do that, so I can't do the treatment plan. So just know something's better than nothing. Work it around your schedule. But I recommend 2 to 3 times a week for the first couple of weeks because I know we're all busy folks and I try to keep a light commitment there, but somewhat of a commitment. So we can keep the effects of acupuncture going. Studies say that acupuncture effects last approximately 72 hours. So that's that building block thing. We want to keep that 72-hour momentum going in the first few weeks, and then hopefully get into the stabilization phase where the patient's feeling relief, seeing changes with whatever health condition. And then they're moving into once a week, once every other week, and then whatever maintenance plan they want. For me, I've already shared my maintenance plan is every week. I'm getting my tank filled. I have a lot of tank filling to do. So also we can treat chronic versus acute, and that also creates how quickly we can treat a condition. So if it's a very long standing, we consider chronic. I think it's greater than 3 weeks becomes a chronic condition. Then the patients, I tell patients, if you've got something, come in as soon as you can, because we'll be able to resolve it quicker than if you've let it go on. For some people let it go on, I can't believe, like 10, 20 years, like a woman with menopause for 10 years, a patient with pain for 20 years. And so those are going to be your patients that are really going to succeed with that repair, stabilize, maintain plan. But it's going to take them longer, and it's going to they might need just ongoing treatment for the chronic folks. Let's see, acupuncture. It is, just to summarize, it is safe and it is painless. It is effective in treating a wide variety of acute and chronic health conditions. And the treatments are very relaxing because we're producing those endorphin flow and neurotransmitter flow through the body. So I wish we had the old Polaroid camera where we could take before and afters. I guess we could use our phone. But that would be a really cool thing, is to do before and after photos, because the patients come in, they're all wired and stressed out, kind of like, ah. And then when they leave, they're like, like floating. And I always say we should have a nap clinic started here at the Cushman Wellness Center, because then we could just charge them for napping through the night. And, so you can visually see it in their face and in their eyes, that endorphin release and the chemical flow. Modalities used in treatment. So we're going to go over to our show and tell table, and I'm going to go through quite a few of the modalities that we use in a Chinese medicine treatment. And there could be more, just depends on what your practitioner enjoys using. We're all artistes in our own practice. And so we all kind of pick and choose what we think is appropriate for the patient and their condition. So let's go over here. We're going to go to infrared heat lamp, which is commonly used in a treatment. I just got done doing a class on light therapy, and I didn't realize how much infrared heat could heal us in many systems of our body, such as immune system. This is great for our immune system. Feels so good. It's also great for my popsicle fingers and my cold nose. But it's wonderful for pain, inflammation. It's wonderful for insomnia. I didn't realize that. It's also great for skin disorders, dermatological conditions. It's great for weight loss with certain other red light protocol light therapies. It's just amazing for many things. It also detoxifies. So it's a very detoxifying treatment. If you've ever been in an infrared heat sauna, it's detoxifying you. And it's going to also help all the things I just went through with this. So infrared heat, I can't say enough with. Also, if the patient is a cold patient, cold joints, say like for the elderly or the not so elderly, this is going to help to disperse cold from our body and our joints and tissues. So love the heat. And it also just gives a nice calming effect when you're using the infrared heat. It just really helps to ground the patient. So our next one that I'm going to show and tell is moxibustion therapy. This is a Chinese herb, also known as mugwort in Chinese, pinyin right? Actually, pinyin. I'm getting that confused. Mugwort, Artemisia vulgaris is the Latin word. Ige is the pinyin word. So if you hear any of those names, it's all moxibustion therapy, same herb. This can be taken internally, not the stick, but it can be taken internally as an herb. Great for the womb, the reproductive system. And then we use also it indirectly or on the skin to produce an effect. Great for nausea, pain, digestive disorders, menses pain. So if you've got a patient or a friend or family member that has a lot of PMS, premenstrual, this will help regulate the period. And then again, I use this a lot for trauma. So if somebody just fell down, we've got the needles in, we've got infrared heat there, we're putting the moxa on them, and it's going to help to regulate the flow of qi and blood, warms, circulates, and decreases pain and all the other many things. So this comes in a smoky stick. We use the smokeless stick, and you just cover it over the patient. You'll see that in the video demonstration I'll be showing you soon. The next one is electrical stimulation. Some practitioners use this, some don't. You may have seen this before. It's known as the TENS unit, Transcutaneous electrical stimulation. It's quite a mouthful. A lot of physical therapists and chiropractors will use this with the pads. However, as acupuncturists, we can attach our little micro clips to the needles and create an even deeper effect. Great for pain because one thing that I like to explain to my pain patients what this is doing, it's like going to the gym, but you don't have to go to the gym. Isn't that cool? So it's contracting and relaxing the muscles, and we're hoping to put those tight contracted muscles into a relaxed state, fatiguing the muscle, relaxing it from spasm and calming it. So that's one great thing that electrical stim does. Relaxes tight muscles, decreases pain and tension. And it's also going to help circulation of blood flow and oxygen too. So that's one that I love to use, and I use that on pretty much all my musculoskeletal patients. You don't have to do it to get pain relief, but I think it can be highly effective. And you can use that all over the body. You can also use it for scarring, scar revision to break up adhesions, tightness. Post-surgically, I used to be a surgical nurse, and I've treated a lot of surgical patients, not only in the hospital, right, the day of surgery and after, not typically with the E-stim right off the bat, but down the road, we can help assist them with scarring and adhesions. So pretty cool. Let's see, moist hot packs. I don't have those here, but we have certain moist hot packs that we put into a hydroculator. Moist heat is better than dry heat, especially as we age, but even if we're not aging, because it's very moistening, and the body likes to be moistened. Tendons, ligaments, bones, we all dry up and age. We wither away as we get older, unfortunately. So moist heat can be very nourishing and tonifying for the ligaments, tendons, muscles, and bones. And that's why water is so important too, because we want to stay hydrated and well nourished in that way. So moist hot packs is another great one. It's also going to help soften the tissues when you have the tight muscle spasms. So it really helps, like before you do your little massage application, to soften up the muscles and the tissues. We've got application of tinctures and essential oils. This I use all the time after, towards the end of the treatment, the patients are leaving with perhaps a sniff ball, which I didn't coin the phrase, but it's an essential oil on a cotton ball. You stick it in a sandwich bag or a glove. It might smell up to a week. They can have that anti-anxiety therapy. So if you see anybody walking across the campus with a purple glove and they're smelling it, they're not going crazy. It's probably a sniff ball in there. But so essential oils are wonderful. They go straight to the limbic system and create an effect emotionally. And then I use a lot of different blends that decrease pain and inflammation, and apply those after. Yeah, I do the moist heat and then I apply the essential oils typically. Either way, it's going to be great. You put the moist heat on after too, and create a greater absorption into the body. And then we've got many Chinese liniments that we use. This is a very warming one, great for the muscles, joints that I talked about earlier. Post them on. I just got it all over me. Does anybody have a tissue? Where's a tissue when you need one? Oh, actually, I have a washcloth right here. I didn't know the post-it-on was going to be leaking. All right, and then massage therapy and healing touch. I'm always touching my patients if they're musculoskeletal pain patients, especially. Patients just typically like to be touched. Some might not, so it's good to ask. If they have trauma. But if they have musculoskeletal pain, I want to have my hands on them. I want to be putting the tinctures, oils on them, and I want to be moving the chi and blood and getting things circulating. Healing touch is another great way. Like I had a patient yesterday, actually, a massage patient, and he had inguinal hernia surgery. He had a lot of tenderness and pain right over the pelvic area there. And so I actually just, in his massage therapy, I included some healing touch. So a less hands-on approach, but still moving that energy field and clearing out the stagnation and the pain. So healing touch can be very calming. And we've got an extraordinaire in our clinic, Sharon Bernane, who does, she's the highest level of healing touch. I'm healing touch too, but still nonetheless, it's all about intention. So, and then another thing that we do, like I said, we launched our ear seed. Actually, let me go to cupping and gua sha, and then we'll segue into the auricular therapy. Cupping and gua sha quickly, both kind of create the same effects. I don't know if anybody's heard of cupping, but we can use the traditional glass cups. We do fire cupping, where we actually put fire in here. That's the word. We warm the cups and then we put them on painful areas. So I'm doing a lot of shoulder, backs, upper back, lower back. You could also do it for coughs, but I typically use cupping for pain. That's what I do. And the fire cupping is really cool because if you put some oil on it before, you can do sliding cup. So it's almost like a massage movement with the warming cups. It is going to leave marks. So if you've got like a special event and you're wearing a backless dress, you're not going to want to go get cupped. And you want to make sure you keep those marks covered until they're all gone, because you've opened up the pores and you want to make sure you're protecting that outer layer of skin, so you're not bringing in any pathogens. Korean cupping is another form of cupping that I do. This is a real fast, easy. You can't do sliding cups with these, but these you can get a lot of pressure and a lot of rising up of the toxins in the muscle tissues. So Korean cupping is a lot of fun, and patients that like to do both. Gua sha is another form of warming, relieving pain, moving qi and blood, decreasing swelling. I actually am moving into some cosmetic facial acupuncture, so I've been using the gua sha tool for a long time on the face. And this is a jade roller, so it's very cool and calming, and it's moving chi and blood. I always like to go upward when you're working on the face, but this is one form of gua sha with the beautiful facial tool. And then we've got multiple different tools we can use on the body to help move the chi and blood and break up that stagnation I talked about earlier, the tight muscles and whatnot. This will also bring up some dead blood and also some, what we call sha. So you might have like a purplish looking, it's not bruising, it's just the dead blood rising to the surface. And again, we're opening pores, so you want to make sure you keep your marks covered. Many tools you can use. This is a nice one sliding down the back. You can get in the neck here and do all sorts of gua sha. You can even use, if you don't have a gua sha, you can use a lid. These feel really good just using a lid. Make sure there's nothing sharp on it, but you can gua sha just with the lid. So gua sha, ancient Chinese medicine therapies.